Next is Dr. Jerome Razanamahery from Dijon University Hospital, France. He's going to talk about clonal hematopoiesis, predicting response to interferon-alpha in ECD and myeloproliferative neoplasms. Welcome, Jerome.
So thank you. So I'm really happy to present this work about clonal hematopoiesis in response to interferon in patients with Erdheim-Chester disease and a cohort of myeloproliferative neoplasm. So for the background, everybody knows that ECD is a rare histiocytosis. There is a systemic involvement, frequent BRAF mutation, and we know that the kinase inhibitors are really effective, but the problem is that there is a problem of worldwide accessibility, and some patients cannot tolerate the treatment in long term. So we know that based on those papers that they are really efficacious treatment, but we all know that interferon-alpha is effective in patients with Erdheim-Chester disease and in patients with myeloproliferative neoplasm, and it was based on that study from Julian back in the day, showing that patients treated with interferon had an advantage in terms of survival in ECD. And we want to see and evaluate the efficacy of interferon in patients with Erdheim-Chester disease, and also evaluate the predictor of response. So we took a cohort of 300 patients with ECD treated with interferon and 77 patients with MPN, because we know that some patients with MPN can have an advantage if they are treated with interferon, in particular if they are mutation in DNMT3A or I6L1. So for the method, we have included patients with ECD and myeloproliferative neoplasm treated with interferon. We had an evaluation of the response, clinical and radiological, and we took clinical benefit rate to evaluate the response because it was considered as a smoldering disease, and the goal was to really control the disease. So we took complete response, partial response, and stable disease to evaluate the response. And we look at the factor associated with the response in the ECD cohort, in the ECD treated with first-line interferon, in patients with MPN, and we pull the cohort. And just for the statistic analysis, we use classical regression, but also machine learning analysis to see the predictor of response. So for the ECD cohort, the median age was 57 years old. Most of the patient was some men, and there was frequent BRAF mutation. And if you look at the overall response rate, 83% of patients have a response, but most patients have stable disease. But if you look at the comparison between the responder and the non-responder, you see that the patient with a response are older at ECD diagnosis. They are older at the first manifestation, and they are frequently men. You see that patient with neurodegeneration does not respond well to interferon therapy. We don't know why, but patients with cardiac involvement had a better response to interferon therapy. Patients with hypothalamic lesion had less response, and patients with lymph node involvement has less response to interferon therapy, and also patients with digestive lesion. And if you look at the other characteristics, so there was no difference regarding the response depending on the molecular status, but if patient had a bone marrow biopsy to see if there was clonal hematopoiesis, there were more frequent gene mutation in patients with response to interferon. And if you look at the number of bone marrow mutation, there was more bone marrow mutation in patients who respond to the treatment. So then we look at the factor associated with response, and if you look at the regression analysis, so there is ENT lesion, the sex, and also the presence, of clonal hematopoiesis. hematopoiesis, predicting the response, and the other part is the machine learning analysis showing that the best predictor of response is clonal hematopoiesis using the random forest analysis. So this is what I told before. So clonal hematopoiesis, the sex, and the presence of ENT lesion are associated with response. And the machine learning showed that the best predictor of response is clonal hematopoiesis in those patients. Then we look at the response in patients treated with interferon in first-line therapy. So most of the patients have stable disease. And if you look at the difference, they are older if they respond. And for those, they have elevated CRP at diagnosis more frequently among the responder. And they have more bone marrow mutation. So the factor associated with response in first-line response, if you look at the old model, this is clonal hematopoiesis that give the best chance to respond to interferon therapy using classical analysis and also the machine learning analysis. So this is for us the best predictor of response. Because we had a lot of response in those patients, we look at the response in patients with bone marrow mutation and patients with clonal hematopoiesis. They had high response rate. Most of the mutation was STAT2, DNMT3A, I6L1, and we could have a longitudinal analysis of the CRP of the patient and the VAF before and after treatment. And the only difference is that there is a decrease of the CRP level with the treatment with interferon, but the VAF doesn't move. And then we look at patients with associated hematological malignancy, and there was a good response, and also there is really few hemopathy worsening with interferon therapy, so it can be really interesting to treat those patients with that. And we look at the patient with identified bone marrow mutation. There is a lot of mutation, 141 mutation identified. And if you look at the response rate, it is elevated in all patients, but most elevated in patients with 2 mutations. So we look at the response in patients with MPM. This is the cohort. It's historical cohort that we took, and you see a response rate of 79, and the first-line treatment was predictive of response in patients with MPM, and we have pulled the cohort of ECD and MPM, and we see good response, and the most predictor of response after an amputation model was the presence of clonal hematopoiesis and the first-line treatment. So this is what we have regarding the response. So it's elevated in ECD, in MPM, and in pooled cohort. So we know that it's a large cohort evaluating interferon in patients treated with ECD. We could identify a factor associated with response with machine learning analysis, and we showed that clonal hematopoiesis is a robust predictor of response, but there is some limitation. We don't have mechanistic experiment to really know how the bone marrow is affected by interferon. We included stable disease into response rate, so maybe it's really overfit the benefits and the overall response. And we don't have a comparison with patients with kinase inhibitors. So the further direction is to have a larger MPN cohort to really have a best balance model and try to compare with data of patients with treated with kinase inhibitor. So to conclude, interferon is effective in patients with ECD and MPM. Clonal hematopoiesis is the best predictor of response to interferon in patients with ECD, and maybe the CH status could guide the treatment. And I want to thank you for your attention and all my collaborators.